Okay, I think we can get started. Today we will introduce a paper which reviews some medical image analysis tasks using this transformer. Here is an overview of this paper. This paper introduces a brief overview of different medical vision tasks in different modalities, and also the different object in image analysis tasks. For example, the brain, the chest, and the breast. This paper also gives illustrations of different medical vision tasks, and we can see what these different tasks mean. The limitation of this paper is that it does not present any performance comparison of different approaches for some of the for the medical vision tasks. Also, it does not compare different approaches. And this paper is not peer reviewed, I think. Okay, first, here is the illustration of all the medical vision tasks that are introduced in that are talked about discussed in this paper. First, about the image denoising. This task considers problem where we have a noisy image and we want to apply a deep learning model or some other approach. And here in this paper, we consider this transformer. We want to apply a transformer model on top of it, and we want to remove the noise and get a very clean image. For image classification, the task is we are given a medical image, and we want to do some classification, basically which class is does this image belong to. For example, in the cancer detection, we need to classify one given city image, for example, given image to be in one of these benign, malignant, or normal classes. For image segmentation task, so we are given an image and we want to segment, basically to segment the area of interest. So this is essentially like a pixel level classification. We do classification on top of each pixel and give it a label, and then we connect them together to get those segmentation masks. For the image captioning, we are given an image and we want to generate some text describing what is in this image. For image synthesis, it is about how can we generate an image from just some kind of input information. For example, we want to generate an image of a normal patient, then we expect some model to generate this normal image just from the description normal. For image object detection task, it's about the locate those regions of interest and also classify those located regions. For example, still consider this classification task. For example, this image can have like a benign region, malignant region, and also normal region. So in that case, we want to mark the location of these different regions and also give it a label. For example, this can be the benign region, then we will give it the label benign. And this can be the malignant region, we give it the label malignant. And this can be the normal region, we give it a label of normal. Another task is about image localization task. So this task is very similar to the image object detection task. The point is that we don't differentiate between this all these identified regions. We give them the same label. That is what you can treat this problem as. You can treat that all of them have the same label. The foreground class. And for image registration, it is about how do you align an image to some other image. do the alignment. About the modalities and the object. So according to this plot, it seems the MRI image and also this CT image are the two most popular modalities that have been considered these years. And for the object-wise, the brain and the chest are the two objects that have been receiving the most attention in these years. Okay, here is an illustration of different image modalities. For example, this is subplot A, is an X-ray image of the chest, and this is the ultrasound image. Usually we care about this black area. And see here is the MR image. It's an MR image of the brain, and this is of the like a CT image of the computer tomography, and this is WCE image, and this is the OCT image, the optical coherence tomography, and this is a fundus camera image, and this H is just a camera image, and the I is a scanner image, and this is a microscopic image, and for K, it's a demoscopic image, and yeah, we have also this colonoscopic and the laryngoscopic image. So as you can see, they are very different from these nature images. Okay, this paper focuses on this classification task and also this segmentation task. So these are the two tasks that are fairly intensively reviewed by this paper. So for this classification task, you can see there are different modalities considered. For example, this X-ray and the scanner, MRI, fundus camera, demoscope image, CT image. And for this object, it can range from chest to prostate, colorectal, breast, and this skin and the retina. And for data set, yeah, we have also different data sets for these different tasks. For image segmentation, still different modalities have been considered in this field, and also apply this approach to different segmentation tasks for different objects as in this column. Yeah. Some other tasks include this image synthesis, image registration, localization detection, captioning, and denoising. Here are some references to all these different tasks. Okay, this paper indeed shows some comparison result for some typical approaches in this segmentation task. For them here, the first column is the selected image, basically the input image to the model, and the second column is the ground truth segmentation mask, usually annotated by a human expert, and then we have different approaches to do this segmentation task, and here these five columns correspond to this method T, and the net transformer, unit plus, and this psi unit. As you can see, since this psi unit achieves the best performance within these several approaches. Another interesting task related to this medical vision is a report generation. So this task is about how to generate a description for an image, for medical image. Yeah. For them here, for this image, the ground truth can be like this: stable right greater than the left upper lobe fibrotic changes, and no opacity in the left middle to low, long raises concern for infectious process versus possibly asymmetric edema. Recommend follow-up to resolution. And if you can take a look at the generated text, like the report generated here, yeah, it contains some of the keywords from the ground truth text. That means it gives you some information about the what's happening in this image. And this reported generation task is very similar to this image captioning. Yeah. Okay, that's all. Thank you.